In Chapter 9 of Inflammation Nation, what did you mean by Step 7, increase immune system functioning?
So keeping your immune system strong is key. So as I mentioned, whole food plant-based diet, right? Get your antioxidants, your phytonutrients, your fiber, your anti-inflammatory protein. Lowering the inflammation with Bosmeric SR, for example. But then moving and keeping your immune system strong is one of the most important factors, because we are not taught in Western medicine the word strengthening your immune system. You know, Western medicine is really good at one thing, something called suppression of your immune system. So if someone has an autoimmune disease, we suppress that system. We give steroids, we give biologics that are destroying or lowering the immune system response, so the patient has a relief immediately, but then they have an onset of other side effects because you need your immune system to fight against a virus, a cold, or someone sneezes on you, you can get a pneumonia. Okay? So we need some part of the immune system. Now, Eastern medicine is really good at that. Indigenous medicines are really good because they've understood this for millennia. The concept of there is certain herbs, there is certain products that people can take naturally in their environment or in a supplement that will help increase their natural killer cell function, that help their immune system function, that keeps them from getting sick. There are tonics out there. There's also specific specified products. So when we look at products that have what they call beta-glucans is a polysaccharide, usually comes in mushrooms, oats, and barley. So as you can see in Chinese medicine, Japanese medicine, lots of mushrooms, right? You go to the store, mushroom extracts. And all the mushrooms have a beta-glucan. And so we recommend all our patients to eat as much mushrooms. I think Dr. Furman talks about, G-bombs and M's his mushrooms. So, eat more mushrooms. Yes. Sometimes people have an allergy to mushrooms, so then we have an alternative for that. But the polysaccharides in mushrooms are only about 20%. So no matter what product, when now we're talking about products now, it's only 20% that they can actually extract the polysaccharide. And some companies can get to a maximum of 40%, but there's a patented form that has been able to take a minimum off a culture, actually it's like a probiotic species, of 83% or more of beta-1,3-D glucan. And why that's important, because now we've done in vitro and in vivo studies independently at universities where they do comparison trials. So they look at the cell culture and they look at the animal and they look at which of these products that come from mushrooms, these beta-glucans from any source, rice bran, oats, and more importantly mushrooms, they looked at about 50 plus different products on the market, and they actually tested which one is more potent, which one is stronger, and the glucan 300 is what we recommend to our patients is the strongest. Now, it doesn't mean that any of the other mushrooms don't work. We just want to look at, well, which is the better one? Because I don't want redundancy. A lot of patients come in and they're taking like 6 or 7 things for their immune system in the mushroom family. I'm like, no, here, just take this glucan 300, eat mushrooms, and now let's get something else that's coming from a different pathway in stimulating your immune system. To further continue on the immune system is simple things like vitamin D, right? That's the simplest thing that people can take, right? And you should have your vitamin D checked from your primary care or your other healthcare practitioners. And we want to get a targeted range between 50 and 100. When people get to between 50 and 100 on that test, there's about a 60% reduction in the chronicity of disease. So it's a simple biomarker that shows, is your immune system good or is it kind of low? And it's not specific, doesn't tell you who, what, where. It's kind of like, did the Pentagon get $762 billion of our money? Yes. Hopefully they spend it correctly to keep us safe. Right? So the idea that what we see then in the literature is that when that vitamin D level is in this targeted range, then whatever disease, whether it's Alzheimer's disease, whether it's mood disorder, whether it's IBS, whether it's arthritis, it gets better and it helps preventing it getting worse, because when your immune system is stronger, your military, your Army, Navy, Air Force, Marines, which I call your immune system, they're able to fight, fix, and defend better. And that's all we're trying to do is always repair and defend, repair and defend, repair and defend, fight and defend. Our whole body, from viruses, from bacteria, from cancer, from injuries. And so when we do that correctly, then your response is better. And vitamin D, again, is something so simple, so inexpensive. Now, can people get it from the sunshine? Absolutely. But most of the time when we test people, we're still not getting as much sun as we should. Even in the Southwest, we get, people are like, oh, I live in Arizona. I live in New Mexico. It's the desert. We should have higher levels. No. And in fact, people with darker skin, so for example, Latinos and Mexicans and Spanish people and African Americans and East Indians, for example, we have the lowest, because the darker our skin, the lower our vitamin D levels, because we don't get melanoma. Right? With the protection of our pigment is that it prevents us from getting skin cancer. But on the flip side, though, it also lowers our absorption of vitamin D. So we should test everybody, and we still recommend everybody to probably take a little bit of vitamin D, especially if they're lower on the range.
What do you recommend for people to take when they have a flu or a cold or upper respiratory infection or urinary tract infection? Are there any safe alternatives to antibiotics that work just as well?
Yes, there's a whole armamentarium of herbal medicine that we give specifically. Some of them are more for bacterial infections. Some of them target more urinary tract infections. Some of them are more, skin infections. Variety of aspects. And this is where herbal medicine is key, because I heard yesterday, they kind of threw out a couple of herbs and they said, well, just take this. And that's good, but we like to get, again, a little bit more targeted, because there's other aspects where, again, those herbs can dysfunction the microbiome. And some herbs have better penetration on different species of bacteria. Some of them are better antivirals. Some of them are better antifungals. And so there's an aspect of education, I would say, on herbal medicine. A lot of people are like, oh, herb's anti-something. Well, there's rankings of those. So we like to look at that in our clinic of if it's this kind of infection, then this is the type of herb that's been shown best in the clinical studies and through traditional use in practice in clinical medicines and cultures around the world. Now, sometimes if it's broad spectrum, so someone comes in, I got a flu or a cold, like I'm here at this conference, and there's all these people coming in, we're flying in, and people from all over from the airport and all, then I use something that's kind of a broad spectrum if I think I'm going to get sick, only the times that I travel, or if I do get sick, and that's called a coated silver. It's a nanoparticleized colloidal silver that's actually a nanoparticle, and it's actually colloidal. A lot of the products in the market you'll hear is oh, I take colloidal silver, I have something that's 11 parts per million over the counter, 23 parts per million. We look at something that's 20,000 parts per million, and it's a nanoparticle. They have studies on it, and that's been patented. And the interesting thing, the studies have been actually done through Department of Defense, through sort of research and funding, and we look at it at having strong antiviral effects, even against Ebola and Marburg virus. So these are things that are very serious infections that we hope we never get in the United States, but we have to look at, can we take something that can have this broad spectrum? Now, it does kill bacteria, it does kill viruses, but the benefit and the detriment of using some of these products is that most people don't realize that when they take over-the-counter what they think is colloidal silver, it's actually ionic silver. We've done studies, or there's people who have done studies that we've actually worked with and looked at the research, where some of the products even that I was using, that I was sold at medical conferences and used for years, is not exactly what they proclaim, right? And so it's kind of what do you mean? You gave me all this information. It's you got to have third-party verification. And so we go through looking at who's the expert in these fields. And when they actually, again, doing comparison studies of all the different silver products in the market, most of them don't even fall into that colloidal range. Second of all, is that a lot of them what they call bioaccumulate. So it actually stays in the tissue. With the coated silver, interesting thing is that we actually can see that it's been excreted out in the urine. So we're not accumulating these molecules. And the other thing is that there's studies right now with the coated silver, which is nice. In culture, it shows that it does not affect the microbiome negatively. So if people do have to take it for a little bit longer time, say they have a chronic viral infection, right? They have a hepatitis or a Lyme's disease of an infection, something that we'd have to take something for a little bit longer than just a 3 or 5 or 7 day kind of thing. Now, I don't like to take any of these products preventatively. I think that's a malpractice, and I think that's a misuse. A lot of people will argue and they'll sell products or endorse products like, take silver every day to prevent something. I go, no, that's kind of, again, overusing something and misusing it. They're not understanding the science of the microbiome, especially with the other products in the market. But even when we give it for a targeted, 3 days, 5 days, 7 days. I'll just give you an example. I had a patient the other day, she had to go for hip surgery replacement, and she had a multi-drug resistant urinary tract infection. So she's seeing infectious disease. They're giving her all these antibiotics, and it just doesn't kill it. Because she's taken, she's had infections before, so they keep on giving it, everything's getting resistant. We put her on there, 3 days later, it's gone on urinary, on culture. So it's just one of those things that we want to keep these things also in reserve. So right now, with this chronic aspect of even maybe epidemics or pandemics in the future, these are things I recommend people just to keep in their medicine chest as, if I need it, I can use it, but I don't use it preventatively. I like to use it like, if I think I'm going to travel, I take one of these, it's 1 drop a day, the day I travel, the day I come back, or if someone gets sick, 3 or 5 or 7 days. If someone's not better by, by day 5, I'm like, then you should go see your healthcare provider. We might have to pull out a prescription, or we might have to do a physical exam, or we might have to listen to your lungs. Most of these things that we like to do is we like to teach our patients self-care, so that most people should be able to take care of almost 90% of their health problems at home, right? My job is just to further define that. If there's an issue, then we go further to the next step.